Hi, welcome back to McMorris Prosthetic Services. Today I wanted to talk about for new amputees and existing amputees that have been amputees for a long time, but maybe it's time to make a change, is selecting a prosthetist and how prosthetists get paid. We'll kind of throw those two in together because it's good information to know, and they do kind of go hand in hand. So when I first lost my leg, I, like 99.99% of us, was sitting in my hospital bed Googling amputation, Googling prosthetics, and that's kind of what led me to start this channel and everything else. But I remember Googling and seeing a prosthetic on like Google Images that had a Nike swoosh on it, and I was like, oh sweet, Nike makes prosthetics, like I'm gonna be set. And being in the hospital thinking like, okay, like, yeah, right now I'm dealing with, like, I had surgery on this knee and my hands has got pins in it, all these other things going on. But eventually the hospital will like send their leg guy to me and I'll get my leg made and we'll start going. And so I got discharged from the hospital and I went to my first physical therapy appointment, and my PT, I expected my PT to have a test leg for me because nobody had talked to me about amputation or about prosthetics and amputation. I talked a lot about how to maintain my skin grafts and like all the medications I was taking and everything, but nobody said like, hey, you're gonna want to call a prosthetist and schedule that. And so I went to PT and showed up again thinking that they were just gonna have a test leg for me. And my physical therapist was like, where's your leg? And I said, I don't have one. Will you tell me, where is it? Let's get it. I'm excited to put it on. And he was like, well, who's your prosthetist? And I was like, what's a prostitute? And then he told me about the amputation clinic that the university hospital has. Like the university hospital has one of the best amputation clinics like I've ever seen, and I'm very fortunate to get taken care of there. But nobody from like the main hospital let me know about that clinic before I left the hospital. My social worker didn't tell me any of those things. And so I scheduled an appointment at the clinic, and I go and meet the doctor, and then he tells me that he's got a couple prosthetic companies that want to come in and talk to me. And so then, a couple guys come in and they explain their company and the differences and yada yada, right? And so I really like that setting for a couple reasons, because in a clinic, a PM&R clinic setting, you have the doctor there, the prosthetist there, and oftentimes the PT there. And so, as the patient, especially for me, brand new, like I didn't have to go to my prosthetist and then go over to see my doctor and tell my doctor, this is what my prosthetist said and this is what we're doing. And I don't even speak the language really, but this is what he said, and hope that there's no miscommunication there. So it's nice to be in a clinic setting like that where everyone's just there at once. The doctor communicates well with the prosthetist tells the doctor exactly what he needs. The prosthetist and the PT communicate about, this is what we're doing with alignment now, this is what we're going to be doing once he progresses to this point. And so it makes it all really smooth for the patient. But often what I'll see is a lot of times new amputees will show up at that clinic or another clinic and they've already been designated to a prosthetist. And that's like, there's nothing wrong with, like, if you selected your prosthetist yourself and you're happy with that selection, then that is perfect, right? And I think that that's the most important thing that I see a lot of the time is sometimes there's, if you're like me and you're sitting in the hospital and you're waiting for somebody to come talk to you about prosthetics, and then somebody just shows up, a lot of us would just assume like, okay, this is who the hospital sent or whatever it is. But there isn't, at least here in Utah and in most of the country, like there aren't the hospital specific prosthetic companies. So there are hospitals that have their own prosthetists in-house, and that, I'm sure that makes things smoother. There aren't really any of those here in Utah other than the VA, of course, and the VA is its own thing. But like most hospitals don't have like an in-house prosthetist. It's a separate thing on its own. And so there are a couple things that are important to understand, and one is that you can be fitted by whoever you choose. You are the patient, the user. You have the agency to make that decision for yourself. There are definitely doctors out there that say like, this is the company that I work with, and yeah, and you know, for whatever reason they like doing things with that company, and so maybe that's a good fit for you just because it works well with your doctor, whatever. But if you go there and you feel like, these guys don't really understand me, they don't really listen to me, I don't feel heard even if they are listening to me, things like that, it's your right to make a switch. I mean, if you're a doctor watching this, I'm sorry, but it's not your decision. Like, it's the patient's decision of where they're being fitted. And there are a lot of, companies. There are so many prosthetic companies, prosthetists. The biggest in the country is definitely hanger clinics. And there are pros and cons to being fitted by a big company and being fitted by a small mom and pop shop. At a big company, you've got a lot of resources, a lot of clinicians, and a lot of ways to get done what you need to get done. But also in those big companies, you may be like waiting longer for scheduling, you may be waiting longer for billing. Everything just has to go more through that bureaucratic process. Whereas at a mom and pop shop, maybe they can get things to you fast or whatever, but maybe they don't have the necessary knowledge for a certain type of suspension that you want, or for dealing with a certain specific billing situation. And so that throws a wrench into things. And so it's really about understanding the process, which is an involved process. And your prosthetist is not like any other healthcare provider you have. It's not like your main doctor, it's not like your surgeon, it's not like your dentist. It's somebody that you'll probably be a lot closer with, especially in those first couple years. And you'll see them often. You will see them a lot, and you'll spend a lot of time in their offices, or they'll spend a lot of time in your home. And so really, yeah, those things, the pros and cons of companies and things, that matters for sure, but it's not at the top of the list. What matters is the person that's fitting you. So, for me, I went to Hanger first because I met a prosthetist there. Him and I clicked really well, and he understood me. We kind of spoke the same language, and so that's where I chose to be fitted initially, because the communication was smooth, and that's what matters the most is how is the communication? Do you feel comfortable there? Do you feel like you can communicate openly? Do you feel like that this person has worked for 2 months on your socket and they put a lot of time into it, but as soon as you put it on, you notice 3 things that don't feel right? Are you going to feel comfortable telling them, like, this doesn't feel good and it's not right, take it back and start over? Or are you just going to be like, yeah, it's good enough, and move on, and then you can't wear it, more than 2 hours or whatever it is? And so what matters is the person that's fitting you, not the company. I mean, like I said, the company has those things come into play, but what matters is the person fitting you. And if you have a good communication with the person fitting you and you feel comfortable with your situation, that is the right situation for you. And it's the same for your socket, everything else. I mean, there's a lot of conversation and arguments even around like, well, is this suspension better than this suspension? Do you get better results out of this or that or this device, whatever it is? And there's like data to back all those things up and show like this one's better than this one or whatever. But that doesn't mean that it's like right for each individual, and finding what's right for you is not going to be what's right for me or right for anyone. What's right for you is right for you, and that is right. Right? I mean, that's a lot of rights I just threw in there, but like, there is no right and wrong. Like at Mobility Prosthetics, there are a lot of like, they do a lot of pin systems, and at the place I was at before that, they did a lot of like 3-stage casts with vacuum. And there's a lot of discussion between those two places of like, is this one better or is this one better? And what I've learned is like, is the patient happy? Is the user like content with their fit? Are they accomplishing the things they want to accomplish? Well, then that one was right for that person, or that one was wrong for that person. But it doesn't mean that like one is necessarily better than the other. It's, in my opinion, up to the prosthetist to decide and figure out what is going to help my patient function the best. And being able to have a lot of tools in their toolbox definitely helps with that for sure. And so those are questions to ask of like, hey, are you pinholed into like, do you only do these 2 types of socket suspensions, or Are you pretty knowledgeable on all of these socket suspensions? What's your casting procedure? And those types of things. Another thing, again, that is important to understand about the process is that prosthetists don't get paid like any other healthcare provider either. They're really like a glorified pharmacist, but with no like say or anything. It's kind of a messed up system at the moment because of prosthetists that messed it up 20, 30 years ago, and one day we'll go into that history maybe. But you know, prosthetists, we don't get to prescribe, I'm not a prosthetist, but prosthetists don't get to prescribe anything for their patients. We have to go to the doctor, and the doctor has to designate the K level, the activity level, and then the devices that are going to be chosen in that level are selected by the prosthetist. But everything reimbursement documentation wise comes through the doctor. And so that can be frustrating for clinicians, especially clinicians that are super knowledgeable. But then also on top of that, you know, when you go see your doctor, you pay a copay if your insurance, you know, requires it or whatever, but your doctor's billing your insurance every time that you see them. If you see them twice in a week, your doctor's getting paid for both those appointments, right? If you see your prosthetist 3 times in a week, he's not getting paid for any of those unless he delivered the final device and you sign for it. So prosthetists only get paid one time. They only bill your insurance one time, and that is when they deliver a final device. So if you're a new amputee and you've gone to the prosthetist 4 or 5 times going through test socket fittings and you know, different little adjustments and stuff, none of those have been sent to bill your insurance yet. The way that they'll just stack all of that up, and then when you are finally content with your socket fit and everything feels good, then your prosthetist will, you know, have you sign the delivery ticket, and then they will bill your insurance. And so that's when, you know, if you're an above knee and you get a microprocessor knee and it's like they build your insurance for $60K, that's a part of it, right? Obviously the device is expensive, obviously the materials and everything is expensive, but a part of it that your insurance is paying for is all of the follow-up care before the delivery, and then follow-up care after the delivery too. And so that's what kind of, you know, makes prosthetists be juggling things at times, not necessarily like juggling their patient load, but the way that they're billing and things like on the back end, not necessarily forward facing the patients, but on the back end, sometimes, especially at those smaller mom and pop places, it's important to make sure that you have like your payments lined up right, because you're only getting paid, again, you know, one time for each patient, when your clinicians that you're paying salaries to have seen that person 4 or 5 times. And so you know, that's kind of just a little inside scoop into how prosthetists get paid. And it is frustrating. It's frustrating for patients at times, and you know, I see that all the time. I know a lot of patients are frustrated with the prosthetic situation, and healthcare in general in America it's not right, you know. And I feel like because amputees are such a small demographic, we're at the bottom of that list kind of, and so there's even more hoops to jump through. And for the clinicians too, I know there are a lot of patients that think like, you know, that prosthetists are taking advantage of the situation, and I'm sure there are those characters out there, but every prosthetist I've met here in Utah is genuinely like, they don't make a lot of money, so they are in it because they care about what they do and they care about helping people, and so they have frustrating jobs at times too, and they definitely get really frustrated with not being able to get us the things that we need, or, you know, the hoops they have to jump through for insurance. So that's selecting a prosthetist and how prosthetists get paid. And yeah, it's getting better. Hopefully it's getting better, and we're moving forward. But you as a patient have the agency to choose for yourself, and I would interview all of the companies that are local around me and go visit them and see their offices, see their billing staff, meet their clinicians, and then once I've met 3 or 4, make a decision from there. And I think that's the best advice is go meet them, go see their offices, go see what they're about, and then make a decision. So that's it for this week. We'll see you next time.